International Tuberculum Sellae Meningioma Study, Surgical Outcomes and Management Trends. This is a multi-center, multi-author retrospective review on the management of tuberculum sellae meningiomas, which reside at the limbus of the sphenoid bone between the optic nerves. Traditionally, this is done either via a transcranial approach or an expanded endonasal approach. And the study questions that we had is, how has the management of this tumor changed over time? It's a very uncommon tumor, accounting for only 2% of intracranial meningiomas, and we want to evaluate the difference in outcomes with respect to vision, extent of resection, complications by approach, and resection between these two different surgical approaches. Study design included 40 sites from around the world, 130 contributing authors, evaluating the approach and tumor size based on maximum diameter. Other variables for evaluation were visual outcomes, which was qualitative, extent of resection, which was based on radiographic images, and complications, which were surgeon reported, and then radiographic evidence of recurrence.
The study cohort included 947 patients. About 2/3 were done through a transcranial approach and 1/3 with an endoscopic approach. Very typical meningioma patients, mid-50s. There was a little bit shorter follow-up with the endonasal approach. The majority of the tumors were grade 1 and about a 70% rate of gross total resection. What we found is that over time, the percentage of tumors resected via transcranial approach decreased, while the use of the expanded endonasal approach increased. We also saw for those tumors resected via transcranial approach, the number of surgeons using a bilateral or midline approach decreased in favor of more of a unilateral approach. What we found with regards to visual outcome is that patients who did not have a preoperative visual deficit had no difference, with the vast majority of patients having stable, good vision, and very low rate of visual worsening, with no difference between an endonasal and a transcranial approach. However, in patients who did have a visual deficit preoperatively, there were higher rates of visual improvement if the surgery was done via an endonasal approach. There were more patients who had vision stably with a transcranial approach and no significant difference in visual worsening between the two approaches. With regards to extent of resection and recurrence, roughly 70% rate of resection in both cohorts and 15% near total and subtotal. There was an 11% recurrence with a relatively short time to recurrence of 36 months. The rate of recurrence was lower after a gross total resection, only 3.2%, compared to 9.6% after gross total resection done via a transcranial approach, with no difference in recurrence rates by approach between a near total or subtotal resection. Complications were overall roughly 20%, with major complications, the vast majority of them being accounted for by cerebrospinal fluid leaks, with a 17% rate in the endonasal approach. As you can see here in this graph, with time on the x-axis, that rate remained relatively stable over time. All other complications, aside from infection and ischemia, which were at 2 or 3%, were less than 1%. So the study was limited by its retrospective nature, no central imaging review. There were slightly larger tumors in the transcranial group, and the qualitative reporting of visual outcomes and relatively short follow-up. In conclusion, the use of an endonasal approach is increasing. Unilateral transcranial approaches are increasing. Visual outcomes were very good overall. If there was a preoperative deficit, patients were more likely to have improvement with an endonasal approach. Recurrence was lower if you could achieve a gross total resection via an endonasal approach. However, the morbidity with CSF leaks remains very high with an endonasal approach. So when a gross total resection can be achieved endonasally, it may provide superior visual and lower recurrence rates compared to a transcranial approach.
I think what this study points out is that collaborative studies can have a significant impact for rare tumors. And in this series, we accumulated over 900 tuberculum sellae meningiomas, even though the authors may have had diverse management options. I'd like to thank the authors who contributed to this study, and I credit them for their surgical expertise with a very low complication rate for this very difficult tumor.